advert. Ẹ̀yin tèmi báwo ni o? Hello Lagos and hello Diaspora. We're talking today about a very, very important topic that connects Nigeria and the diaspora. I have with me today a very, very important personality, and the man himself, Dr. Clife Eke. He is the president of ANPA, and ANPA stands for
Association of Nigerian Physicians in the Americas.
Yes, that is a very big organization. And over, I believe, 8,000 physicians, doing great things. Nigerian doctors are renowned globally, but in America, they are doing even extremely great work. And we are here in the Office of Diaspora Affairs, and he paid a courtesy visit there in Lagos to do some great work. Tell us about what you're here for.
Okay, first of all, thank you, Mr. Jermaine.
Thank you much more.
Director of the Diaspora Affairs for Lagos State Government.
Yes, sir.
For me to be on your podcast.
Thank you.
Yes. So we're here in 2025 in Lagos because ANPA is turning 30 this year.
30. Wow. 30 years.
30 years, so which is a big milestone, as you know. So we felt it would be appropriate to celebrate in the motherland or fatherland, depends how you look at it, right? So we're doing two great events.
Okay.
One is what we call our ANPA Week, where we come and we train medical personnel, we do capacity building, and we do free surgeries, free medical care. And we're gonna do that from April 4th to 9th at several centers, which we can go in later on. And then another big one is our scientific convention, which we then do from April 10, 11 to the 12th. And this is where we talk about advancing patient care.
Yeah.
That's the theme.
I remember when Anaheim the other day, around June last year,
You were there.
convention with the Foundation of Health too.
That's right.
So we know you guys deliver excellence all the time.
Thank you.
You mentioned about trainings. What kind of trainings are you going to be having here?
Okay, so for ANPA Week, we have several trainings. One, helping babies survive, which is basically neonatal resuscitation for newborns. As you know, in Nigeria, neonatal mortality is high.
Hi, yeah.
So that's one. Two, we're doing also BLS, basic life support for adults.
Good.
And then we're also doing stop the bleed.
Stop the bleed.
Trauma. People, simple things, a car accident, they're bleeding. You can put pressure, pack it,
And all that.
put tourniquet, stabilize them, slow down the bleeding before emergency care comes.
Very good.
Then beyond that, we're also doing a new thing called CKD, chronic kidney disease.
Yeah, you mentioned that earlier, and I was like,
Yes.
this is unique. Tell us more about it, because guys, I'm sure, well, as half of those of you in medical field, this is very, very important information. Share that.
So besides the basic risk factors, high blood pressure, diabetes, the medications,
Yeah.
one big risk factor, especially for us black folks, sub-Saharan Africa, is what we found out is apolipoprotein gene.
Okay. Apolipoprotein gene.
That's right.
I tried.
Or AP, very good. APOL1 gene.
One time, yes.
And this is a gene actually, Mother Nature changed our DNA, mutated exactly, to adapt to sleeping sickness
Wow.
caused by tsetse
Yes.
back in the day.
Back in the days, yes.
Exactly. So even though it worked, one of the side effects, it causes fibrosis or scarring of our kidneys and can lead to kidney
problem.
Yeah.
Okay.
And I'm reading from literature, up to 45% of us
Wow.
are carrying
Areas of
for the gene. And so when you have the homozygous, which means both genes,
Wow.
then you're very high risk for.
High risk. And so a man and a woman who are carried the genes,
That's right.
if they will get married, have children,
That's right.
the children are high risk
That's right.
of having kidney failure. And most people are more aware about sickle cell, but they don't really know about this.
lipo.
Yeah.
Yes. Yeah. Sickle cell is similar kind of thing.
Right.
If you're exact AA or your AS, my AS is right. You have the similar.
So yeah, and because we've seen a lot of people, I know the publicity is amongst those in Nollywood and all that, but I believe as you're educating people, it also to educate other people, because I believe you're educating them some medical personnel.
That's right.
It is vital information, and we are really appreciative of your investment of time and intellect into this. That is the training you're going to have
If you are 20 years old,
What training?
part of the CKD, we have vascular surgeons
Vascular surgeon.
who are coming to teach how to do, because now, even though we're trying to prevent the disease, obviously, and make awareness, right, and advocate for that. But there are people with the kidney disease already now. We have to take care of them, right?
Yeah.
So they need dialysis.
Yeah. Yes.
And unfortunately, here, a lot of people, they get catheter, then they remove it. So we're trying to teach how to do AV fistula, which means you connect the artery and the vein
Wow.
so that they can access it easily. Easy to do dialysis, which is much easier than putting the catheter. They can. Our vascular surgeons is going to have hands-on training.
Wow, that's amazing.
And then after that, we go to Luth and actually do it on patients.
Wow, that's amazing. You know, and that I can put that the diaspora has more than just remittance that will benefit, you know, the country. This knowledge is going to save lives. And we appreciate your leadership as ANPA President. This is coming to Lagos at this very important time. You also mentioned that you're being one of the top 5 surgeons when it comes to glaucoma and all that in the world. Tell us about.
Yes, we are very honored to have had Professor Leon Hendon.
Leon Hendon.
Well, he's one of the top 5 ophthalmology surgeons, especially glaucoma surgery experts in the world.
Wow.
And he's a professor at Duke University in North Carolina. So he's we're gonna be operating with him at Indo Eye Clinic Foundation.
Very good.
And because he's coming, we are partnering with also the Ophthalmic Society of Nigeria, OSN.
OSN, yeah.
And they've brought over 60 of their members.
Wow.
To attend. Because they all know amazing. Yes. So he's going to teach. There'll be lectures, didactic lectures.
Yes.
Then afterwards, he's going to operate on patients who have been screened already.
Where?
By OSN.
That's very good.
And so they'll get to learn how to do this procedure,
wow,
which is very rare.
And that's amazing. That's also knowledge transfer.
Absolutely. And capacity building.
Capacity building. Another thing that the diaspora can do, and we are really appreciative. I can't stop saying thank you. You know, and that's what I tell people, that yes, Nigerians in the diaspora have a lot of skills to bring, but they also have networks. So the doctor that is coming, I think is
Dr. Hendon.
Dr. Hendon that is coming.
Yes.
He's not Nigerian,
no,
but he's a friend of a Nigerian.
Exactly.
You know, so you have many connections there that can be useful to the motherland. So diasporans, your connections, your skills are very, very valuable. You also mentioned that apart from the training, I'm sure you're going to do more trainings.
Right.
You have the conference that is taking place. How many people, first of all, are coming from the diaspora, from ANPA, and how many people are going to be attending that conference? And tell us about the venue.
Okay, so for our mission, our ANPA week, we have about 130 diaspora. These are doctors, dentists, biologists, you know, they come in.
This is all we say.
And this is the biggest we've had.
Biggest ever that you've had
in the history of that.
Thank you so much. You know, you would say ANPA Wapa. I mean that. Yes. Is that you guys? Thumbs up, you're cool, you're good. You know, ANPA Power has seen it also in Lagos. So that's fantastic. 130 people are coming.
Good.
Where is it?
But there are more also coming that didn't come for the mission.
Wow.
So at least 50 more.
50 more.
So that we're pushing 180. And then we made the convention, by the way, be at Echo Hotel.
Echo Hotel.
So April 10 to 12, like I said.
April 10 to 12.
Right.
Good.
And then the theme, like I said, is advancing patient care.
Good.
Through leadership, research, and strategic investment.
Wow.
It's a business as usual.
Very good.
And we want to align diaspora physicians, our healthcare providers, with those at home, our colleagues.
Very good.
To again improve healthcare.
Okay, that's fantastic.
So to do that now, you were in Anaheim.
Yes.
Our convention in Anaheim, for us to attend and get a CME or CPD, we'll call here.
Yeah, the points here.
That's right, the points. Each of us pays about $400 US.
Wow.
But because we want our colleagues to be part of this, we discounted it to only 50,000 Naira. So a lot of people from the NNA and then residents, CURICs, all those people were encouraging them to come. So wow, a big dialogue.
A big dialogue. So discounted is just, you know, a little fee. So yes. And can they still register?
Yes.
Wow. So the Nigerian doctors, wherever you are, please take advantage of these, I believe, how many days?
It's going to be 3 days, yeah.
Of leadership, research, everything to improve healthcare delivery and patient-centered care. And this can also add to your CPD point. So ANPA Power is coming to Nigeria. ANPA, they are truly on WAPA and they're doing great work. How can they reach you and connect with you to register? What's the website?
Okay, www.ampa.org.
Yes.
And then we also have an app called myampa.com. So in either of these avenues, you can reach us.
myampa.com
or ampa.org. .org. And then you click on the 25th, or you click on the
convention. Okay.
Yeah.
So the ANPA.org, you can be able to register for the company and all that. Also download the app, which is My ANPA on Google, I'm sure, Apple iStore, so you can get more information about them. We really appreciate you, and we can't go without saying also thank you to the Honorable Commissioner for Health, for the part to play. Professor Abayomi. Also, I must mention the diasporan who was based in UK and all that. Also, Dr. Mrs. Kemi, who's the special advisor on health to the Lagos State Governor. We thank you also for your support and all this. And we can't go without mentioning people like the Federal Minister.
Oh yes, Minister of Health.
The Federal Minister of Health, that was very, very helpful.
Dr. Salako.
Dr. Salako, very good.
Also, Dr. Pate.
Dr. Pate, they've been very, very helpful.
The office, supportive, and even our NIDCOM, Nigerian Diaspora Commission, the Honorable
Dabri, she called and said, ANPA's coming over.
Yeah.
And she'll be here. She'll be there, yeah. So fabulous. So we're glad to have her.
And we have a gala, you're coming to the gala.
Hey God, there's no party like a Lagos party. Of course I'll be there. I look forward to it, and thanks for the invite. Let's not forget Miss Dr. Let's call him His Excellency Alausa, the Minister of Education now.
He's actually been very key with partnerships
are held down. Yeah,
exactly. Connection between us and Lutz and Meta and all this, our partner. Yes, Dr.
We really appreciate you for your leadership and your support too. So there's going to be training, there's going to be a conference, there's going to be a Lagos party, ANPA, Toapa, Styling, here in Lagos. And I believe you're also going to saw, some of our sites, Azu Center, the beaches and all that. And I would encourage you, an integral part of also the conference is the business investment part of it. Yes. Lagos means business. It's the center of excellence, city of aquatic splendor. A lot of opportunities I believe are going to come from this interaction that we're having, whereby you can invest real estate, invest in properties that you could use to do our hospitals and all that. Programs like hopefully adopting hospitals one day. More of this. This is just the beginning of interaction with the diaspora, and I'm so glad that is happening under your leadership as president. Let's give a shout out to the former president too.
Yeah.
What should go next?
No, it's there. Shout out to you, actually, Dr. Chichi and you.
The others were yes. I'm also to an exco. They've been working very hard because, in the US, it's easier for us to actually do things there because you live there. But we're doing it in Nigeria.
Guys, it don't mean so this year.
So get your name, okay, our president-elect, Dr. Jeep Landry Jeep Joyce, working hard.
Yeah.
Also, Dr. Tolu, Baba
Tokwe, yes, yeah.
And Dr. Ibidabo, also Ibidabo is helpful planning. And of course, His Excellency,
the governor of Lagos State, saving you the best for last. And we know that it has been a collaborative effort. Everyone has come together to make this happen. And also your board members and all that, they've been very, very supportive too. And I wanted to save the hype for the governor to the last, because Governor Babajide Sanwo-Olu is the governor of the diaspora, as I call him. Under his administration, he's been creating policies, appointing a lot of diasporas into government, ensuring that diasporas have this kind of ease entry to Lagos to do what they have to do. Sometimes I must really commend ANPA. You are resilient, you knew what you wanted, and despite any obstacle that came your way, you kept on pushing. ANPA is for real. ANPA is legit. Stories are flying around, but they are here to do good. and we are encouraging them to do good and supporting the Lagos State government in achieving the vision of a greater Lagos rising, which Governor Babajide Sanwo-Olu in the Think Plus agenda has so creatively articulated. And we thank you, Mr. Governor, thank his wife also for being, she's a physician. She's a physician. Yes. We're going to try and make that connection too. I'm sure she will love to meet you guys too. So we'll make all those things happen by God's grace. Thank you guys so much for watching. Make sure you visit anpa.org to register to find out more about this amazing organization. And also, you want to register, visit My ANPA app on the Apple and Play stores. Thank you so much for this time. If there's anything you want to say in signing out or
sliding out, just know that ANPA cares.
ANPA cares.
And we're giving back.
So give it.
We are being paid for this. And it's not easy for us. But when it's easy, anybody can do it. We're doing it because we love our country, we love our people, and we want to give back. Yeah. We just want a conducive environment, and we work with our people. We have enough people. So what, 250 million people.
Wow, amazing.
So we're not coded to feel like we're coming to take over. No. We're coming to work,
collaborate, work with us,
and make things better for our people.
That's
at the end of the day, it's for our people.
Our people.
Yes.
You know, I remember your advert. So, share what? Say what? ANPA is ensuring that we're buying your health and everything. Thank you so much for watching. Visit JermaineSanwo-Olu.com for more inspiring and informative podcasts like this. Dr. Clife, President of ANPA, Association of Nigerian Professionals Positions in America. Thank you so much for being here. We appreciate you and wish you great success in the coming days.
Thank you. Appreciate it.
Cheers, guys.
Yeah.
Bye.